that it's your passion that fuels your purpose. But what drives that passion and purpose often is a painful event.
Hi, and welcome to the next episode of On Purpose. Today, I'm joined by Dr. Leana Wen.
Thank you so much, Kristin. Great to join you. Thank you for having me on your show.
Great. For those of you who do not know Leana is an author, Leana is a physician, and she is a columnist for the Washington Post. So when you were 8 years old, I believe you and your family, your father was a dissident, and you were able to immigrate to the United States. That seems like a pretty massive change for a small child. What was that like, and what did you learn from that experience so young?
Well, when I came to the US, I didn't speak any English. We ended up coming from a very large city in China, Shanghai, 26 million people, to a small town in the mountains of Logan, Utah. So it was a very different experience. I saw snow for the first time. No one around me spoke Chinese. I didn't speak English. After that, we moved to Los Angeles, and that too was a very different experience, coming from this small town in rural Utah to really big city in LA. And there I saw many people going without access to healthcare. I had neighbors who could not afford their diabetes medications, or who had heart attacks and were not able to get those treated because they were undocumented, because they didn't have health insurance, because they didn't have the ability to pay for their medications. And I wanted to become a physician, but specifically to work in an environment where I never had to turn patients away because of inability to pay, because of fear of their immigration status, and so forth. And so that was one of the reasons why I went into emergency medicine.
So clearly public health was something you were committed to very early on, but I think for many Americans, maybe COVID, the health crisis, was the first time that they saw the importance of public health and really the crisis of public health. You were very much on the front lines of that, and would love to understand, what were the challenges and what are some of the insights you took from that experience?
Well, running a local health department, I already knew many of the problems with public health, that it is consistently underfunded because no one likes to think about prevention. It's very difficult to make the case for something that didn't happen as a result of your work, right? There's a saying that there's no face of public health. And literally, public health succeeds when we prevented that thing from happening. Some of the greatest public health victories have been the elimination of polio, the elimination of measles in the US. And I have great fear that some of these vaccine-preventable diseases may return as a result of widespread misinformation around vaccines.
I wonder if you might share where you think AI can really, improve healthcare and sort of public healthcare.
Yeah, it's a great question, and one that we can talk a lot about, as you and I have in the past, about the potential for AI. One is in diagnostics. The fact that AI is now being incorporated into, for example, colonoscopies or mammograms to help the operator. So AI is not replacing the radiologist or the gastroenterologist, but I would like to have a colonoscopy that's enhanced by AI in case there's something that the gastroenterologist may be missing. And then another example that comes to mind is in treatment and diagnosis for underserved areas, including remote areas in the US and around the world. Already, AI applications are being deployed, for example, in reading chest x-rays for people with tuberculosis. It's being deployed in ultrasound in pregnant women who are in remote areas. And so I think that there's really incredible potential.
So one of the things that I've really loved most about both meeting you, reading your book, and your column is your authenticity and your willingness to be vulnerable. And I wonder if you might share some of the biggest struggles that you faced in your career or in becoming a mom.
Well, I so appreciate this question. For me, growing up as I did in an immigrant family, my parents didn't have any connections. I didn't know any doctors other than the doctor that I personally went to as my pediatrician. And so I had a lot of doubt about whether I could do this. It actually took me years in undergraduate when I was in college to even tell people that I wanted to be a physician, because I thought that people would laugh. I thought that people would look at the humble background that I came from and think, who are you to want to have this dream? So I would tell people that I wanted to be a lab tech. And truly, I've been very fortunate over the course of my life to have mentors who at really critical inflection points told me that I could do something that I didn't have confidence in myself that I could. And this is the reason why mentorship now, for me, paying it forward, if you will, is so important, because I see in some of the students that I mentor that same lack of trust in themselves.
So one of the other struggles you've been open about is one that I've actually, as you know, been open about, which is infertility, which I think so many women struggle about, and often silently. So would love to know, what did you learn from your struggles with infertility, and how has that impacted, what you've done as a physician and a public health advocate?
Yeah, when I was in my mid-20s, I was diagnosed with cervical cancer, which came as a huge shock. And as a result of the procedures that I had, my husband and I had difficulty conceiving. And we went through a lot of different treatments. I also suffered a miscarriage during that time. And it was really hard. It actually felt really isolating at the time, because I didn't tell people around me. I didn't tell my friends. I didn't tell my colleagues. I suffered through this alone, which I really wish in retrospect that I did not. And so I think all of those experiences have informed who I am. One of my mentors, the late Congressman Elijah Cummings, used to say that it's your passion that fuels your purpose. But what drives that passion and purpose often is a painful event, that it's pain, passion, and purpose that end up being who we are.
Thank you so much for joining me today, Leana. As always, in every interaction I have with you, it was incredibly inspiring. And thank you for joining us for this episode of On Purpose. We look forward to seeing you again next time.